We will be doing a presentation and sharing information on Rock County's Community Health Assessment and Community Health Improvement Plan. Before we begin, I would like to introduce our presenters. My name is Allison Chenard, and I am a Public Health Supervisor with the Rock County Public Health Department. Also presenting is Nick Zupan, an epidemiologist with the Rock County Public Health Department. And also presenting Michael Niles, Public Health Strategist with the Rock County Public Health Department. In addition to the introductions, I wanted to also share that Rock County has a committee and advisory committee called the Health Equity Alliance of Rock County that informs and helps guide the work that we do for the Community Health Assessment and Community Health Improvement Plan. The Health Equity Alliance of Rock County, or HEAR as it is commonly called, is a multi-sector collaboration that aims to ensure that Rock County reaches its full health potential through a commitment to equity. Some of the HEAR members include local health systems, the local health department, free and charitable clinics, United Way, school districts, library, food pantries, churches, community nonprofits, and so many more. The diverse members is what allows for us to be successful in a collective impact approach. Just think, when you have all of these different perspectives looking and working at improving health and addressing issues, you're going to tackle it much more effectively. These stakeholders not only help decide Rock County's Community Health Assessment health priorities for the Community Health Improvement Plan, but the group works to implement the activities. What is a CHA chip? A CHA is also called a Community Health Assessment. A Community Health Assessment uses various assessments like surveys, interviews, and secondary data to find out what are the main health needs, issues, and problems in an area or county like Rock County. And a CHIP is also called a Community Health Improvement Plan, and it is a long-term systematic effort to address public health problems based on the results of the Community Health Assessment. And a CHIP plan is typically updated every 3 to 5 years. So the CHA informs the CHIP. And from the image on the slide, you can see there is a process. This process includes doing several assessments, called the CHA, choosing priorities based off data from the assessments, making a plan for the priorities, called the CHIP, implementing the CHIP plan with population-wide strategies and interventions with measurable results, and continual evaluation and an improvement process. It's important to be transparent and work collectively with many stakeholders throughout this entire process to improve community engagement and accountability. Here are the steps in the process of doing a community health assessment and community health improvement plan. Primary data is a type of data that is collected by researchers directly from main sources through interviewing people in a community, conducting community-wide surveys, utilizing local focus groups, or conducting experiments. Primary data are usually collected from the source, where the data originally came from. Secondary data is the data that has already been collected through primary sources and made readily available for researchers to use for their own research. It is a type of data that has already been collected in the past. Some examples of secondary data include the county health rankings and roadmaps, the Centers for Disease Control and Prevention, and the Wisconsin Department of Health Services. Additional steps include doing a public health systems analysis and a forces of change assessment. After all the data and assessments are done, then the Community Health Assessment Report is created, and then finally the Community Health Improvement Plan. Here listed are all the community health assessments and tools used in gathering information and data for our Rock County Community Health Assessment Report. We use both qualitative and quantitative data. and we will now look at each of these assessments and results in more detail.
So one of the pieces of data that we collected over the community health assessment process was called the Community Health Assessment Survey. This is a survey developed by HEAR members, and it involved many different questions about people's perceptions and their experience related to health in Rock County. The survey was distributed online and in paper form, and we captured the responses of over 1,000 residents in Rock County. So this was 1,030 respondents to the survey. We wanted to identify strengths and areas for improvement and other factors related to people's health. From the survey responses, we were able to identify the top strengths in Rock County. These strengths included access to recreational areas, good places to raise a family, good schools, the ability to continue living in my home or community, and community safety. The survey also allowed respondents to indicate areas for improvement for Rock County with respect to their health. So the first area for improvement was identified as access to affordable housing. Respondents also identified that good paying jobs and strong economy were areas we could improve upon. In addition, access to mental health services, racial and ethnic diversity, and access to affordable health care were all areas that we could improve upon in Rock County. The other piece of data that we collected through this process was called community conversations. And these were like focus groups where we worked with various members of the community and got groups together to really talk about the issues that they were seeing in Rock County and their experience of health and what it means to be healthy in our community. We tried to target a diverse section of the population. We hosted 17 with 14 different types of groups. Included in these groups were African American or Black fathers, youth from the Fresh Start program, youth justice workers, staff involved in child protective services, individuals who work with the House of Mercy, Can Do Industries, the Council on Aging, Head Start, and the Health Equity Alliance of Rock County. The words you're seeing here are some of the key themes that were identified in these conversations. This includes mental health, healthcare accessibility, insurance, transportation, alcohol and other drug abuse, as well as some of the other factors listed here on the slide. Another way we tried to capture information and the perspective of our community was through key informant interviews. The key informant interview process involves working directly in a one-on-one conversation with key leaders and stakeholders in Rock County. So the purpose of this is to gather more detailed information. In addition to the assessment survey and the conversations that we had, we wanted to get a little bit more detailed information from key leaders in Rock County. So these types of leaders that we recruited for these interviews included members of law enforcement, clergy, healthcare leaders, and key leaders who represent minority populations in Rock County. Altogether, we completed 22 different interviews. From these key informant interviews, there were a number of different pieces of information that were identified. One of the pieces of information were assets that were very important to the health and well-being of Rock County residents. The top assets that were identified in these key informant interviews include nonprofit organizations, public organizations, recreational areas, our schools, and our hospitals and clinics. Our key informants also identified threats to people's health in Rock County. The top threats that were mentioned most frequently were mental health, healthcare issues, substance use, insurance coverage, and COVID-19.
The local public health systems assessment is a valuable tool for identifying areas for system improvement, strengthening local partnerships, and ensuring that a strong system is in place for effective delivery of day-to-day public health services and response to public health emergencies. The general audience for this instrument is the local public health system, which includes organizations such as local health departments, healthcare providers, human services organizations, schools and universities, other governmental agencies, and many more. Essentially, a public health system is any organization that is focused on the health and well-being of the population. This assessment gave our stakeholders the opportunity to score each of the 10 essential public health services on a 5-point scale ranked from no activity to optimal activity. The respondent was asked to rank each of the 10 essential services on this scale with regard to their perception of how well the service is addressed in our local public health system in Rock County. Participants were also asked to comment on any strengths or areas of improvement relating to each essential service as well. In total, we received 9 responses out of the 30 surveys that were sent out. On the left side of the screen, you can see how the activity categories are broken up. We have 5 stars for optimal activity, 4 for significant, 3 for moderate, 2 for minimal, and 1 for none. If you look on the right side of the screen, you can see the average number of stars or activity level that was given to each essential service based off the 9 survey responses. As I mentioned previously, we also gathered some info on strengths and opportunities of each of the essential services. This is just a small graphic showing some of the more heavily mentioned topics with regard to strengths. We have health literacy, communications, and data tracking as 3 of the themes that were frequently mentioned for the strengths portion of the assessment. For the opportunities section, we have mental health shortage, workforce development, and health equities and disparities education as the top 3 themes. The Forces of Change assessment focuses on identifying forces such as legislation, technology, and other impending changes that affect the context in which the community and its public health system operate. The Forces of Change assessment answers 2 general questions. What is occurring or what might occur that affects the health of our community or the local public health system, and what specific threats or opportunities are generated by these occurrences? Forces of change can include natural disasters, redevelopments, changes to local, state, or national laws, demographic or geographic trends, or the opening or closure of large employers or community organizations. Assessing forces of change allows us to consider the context of health outcomes and incorporate strategic activities that address threats or opportunities created by the forces of change into the community health improvement plan. The Forces of Change survey identified 31 forces of change. Some of the forces of change identified on the survey include addiction, climate change, COVID-19, healthcare costs, obesity, racism declared as a public health issue, and redevelopments in the Beloit and Janesville areas.
In addition to the primary data that was collected through this assessment process, we also turned to secondary data. So secondary data is data that is available through the state or national sources that sheds light on some of the health issues that didn't come up directly in the survey responses or in the conversations that we had with community members. The secondary data can also confirm the trends that we saw in our conversations and in the survey responses. We collected secondary data related to the social determinants of health. So these are various aspects that have an influence on health and well-being, but are maybe not always thought of directly related to people's health. So the first piece of social determinants data that we looked at was education, access, and quality, healthcare and quality of healthcare in Rock County. We also looked at the neighborhood and built environment data, as well as social and community context data and economic stability. So in the Community Health Assessment report, you will see a number of different types of data that we used to look at key health issues across the county. We don't have enough time, unfortunately, today to cover all of the different pieces of secondary data that we collected for this assessment, but I'm just going to go through a few examples of the type of information that we collected and some of the details that we look at when we're looking at the secondary data. So the first piece of secondary data that I want to provide for the presentation for today is related to the opioid overdose death rate. And this is a rate per 100,000 population over the years of 2010 to 2019. We can see on the line graph that the trend is moving in an upward direction. And that means that opioid overdose deaths are increasing in Rock County. This piece of information is important to take a look at because we want to see both kind of the number of deaths and the death rate that we're seeing in the most recent year, but also the trends over time. Are we getting worse? Are we getting better? These types of questions are best answered by a trend graph or a line graph that we're seeing here. Another way that we can look at data is simply the proportion of individuals who are engaging in a specific behavior. In this instance, we're looking at the number of high schoolers who are reporting excessive drinking. It's important to kind of capture the proportion of people who are engaging in a specific behavior to really understand how prevalent this behavior is across the population. So when we're talking about high schoolers, 1 in 8 high school students reported excessive drinking when they were surveyed. So this is roughly about 12.5% of this population, and this helps us understand how prevalent this behavior is. Another piece of data that we're looking at is with respect to mental health is the number of students who report having mental health support. So this isn't necessarily the percentage or the proportion of the population that engages in a certain behavior, but rather the percent of students who have a support in their life. So one of the pieces of information that we try to gather is understanding how students interact with their surroundings and how many students have protective factors in their lives, especially with respect to mental health. Mental health became a pretty strong key theme that was identified in our community conversations and key informant interviews. And so digging deeper into this data, we start to better understand the components that keep people healthy and have protective factors for their mental health. So the first piece of data is related to the percent of students who report that they can get emotional support when they need it. 21%, or about 1 in 5, indicated that they could get emotional support when needed. On the flip side, when we look at those students who report having an adult they can rely on, more than 80% of these students indicated that they have an adult they can rely on that is other than a parent. So although students may not indicate that they have emotional support when needed, many of them do have an adult they can rely on. So again, this type of information helps us shed light on some of the details of mental health. When we talk about mental health kind of bubbling to the top as a key health priority for Rock County, we need to dig into some of the secondary data to see what are the details related to mental health and how can we address these details.
From all the assessments and data collected, there were 6 top health priority areas or themes identified. Those were mental health, access to care, substance use, chronic disease, built environment, and economic stability. From the 6 health priority areas, the HEAR committee had to vote on 2 priorities for the HEAR committee to address and really focus in on for their efforts. The top 2 selected areas were access to care and mental health. So, where are we currently at in our process? We just finished writing our community health assessment report and beginning to look at strategies on mental health and access to care for creating our community health improvement plan. So now I will hand it over to Michael to explain a little more on the community health assessment report and the community health improvement plan process.
A CHA, otherwise known as a community health assessment, refers to an assessment that identifies key health needs and issues through systematic, comprehensive data collection and analysis. The ultimate goal of a CHA is to develop strategies to address the community's health needs and identified issues. A variety of tools and processes can be used to conduct a community health assessment, but it's essential that a CHA is created through community engagement and collaborative participation. The information gathered in a CHA can help develop a community health improvement plan by justifying how and where resources should be allocated to best meet a community's needs. The 2021 Rock County Community Health Assessment is now available on our website. A Community Health Improvement Plan, or CHIP, is a long-term systematic effort to address public health problems on the basis of the results of community health assessment activities and the community health improvement process. A CHIP is typically updated every 3 to 5 years. So why is the CHA-CHIP process important? There are numerous benefits to completing a CHA-CHIP process, including improving organization and community collaboration throughout Rock County, strengthening our partnerships within local public health systems, identifying Rock County's health strengths and weaknesses for quality improvement efforts, and it provides us the ability to increase the public's knowledge about public health and the overall interconnectedness of the activities we do. The CHIP will be completed early 2022.
So like I mentioned before, we have a HEAR Advisory Committee and a General Body HEAR Committee that helps to guide and contribute to community health work and improvement. From the Community Health Assessment, we have identified mental health and access to care as our HEAR priorities. Our HEAR Committee has created 2 subcommittees to form strategies around mental health and access to care that will become our Community Health Improvement Plan. And we are using evidence-based approaches to accomplish this. And we will continue to do reporting and quality improvements on our Community Health Improvement Plan. We also plan on bringing additional partners to the table to work on these areas. We will be including health equity in all the work that we do. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences. Health equity can help bridge divides and foster productive dialogue among diverse stakeholder groups. Finally, I wanted to share that there is a Rock County Board of Supervisors resolution recognizing access to care and mental health as Rock County's Community Health Improvement Plan priorities. If you have any questions on this presentation, or if you would like to become a HEAR member, please email our HEAR coordinator at hearcoordinator@co.rock.wi.us. Thank you for listening to this presentation today.